Hi everyone. So today we will be discussing about OCD, that is obsessive compulsive disorder. So which is considered as one of the type of anxiety disorder. So in anxiety, while doing the anxiety disorder sessions, so I have explained you there are many types of anxiety disorders. This is one of the major type of anxiety disorder. So it is characterized by repeated thoughts, repeated unwanted negative thoughts and recurrent behaviors, recurrent actions we can tell. So this is the definition of OCD, where there will be repeated thoughts will be there. Again and again you will be getting a same or a negative thoughts again and again there it will be occurring, and to overcome anxiety because of that negative thoughts you will be doing some actions repeatedly. So as thoughts repeats and action also repeats, so that is called OCD. So in OCD, obsessive, O means obsessive, and that is obsessive thoughts, and C means compulsive actions. So where obsessive means getting repeatedly, so repeated thoughts here the person will be getting repeatedly negative thoughts, and compulsive actions means where a person is forced to do that particular action because of that negative thoughts. He has to get relaxed means he has to do that action. So because of thoughts he is getting anxiety, and to get to overcome that particular thought, to overcome a particular anxiety, he has to do the actions. So it becomes again and again. Okay, so some of the symptoms of OCD are anxiety. So a person will be very anxious. Okay, you will be expressing lots of anxiety or a kind of anxiety, and there will be negative thoughts most of the time, or 99% of the time the person will be getting negative thoughts, like something negative about his performance, something negative about his life, maybe a negativity about his family, about his relationship. So most of the times it is a negative thoughts only, and there will be repeated cleaning and washing. So repeated cleaning and washing comes under the compulsive actions, where person will be doing the cleaning regularly. Even though the things are cleaned, he wants to clean it again, he feels it is not clean. And washing it, maybe washing his hands regularly, washing his face regularly, or taking too much of time to take bath or bathing regularly. So washing and cleaning will be repeatedly done. Then arranging and rearranging, once he arranges the things, he feels it is not properly done, again he rearranges. So repeatedly this will be done. Okay, not one or two times, it may be a 5 or 10 times. And most of the time, as the day by day the OCD increases and there is no medication, there is no treatment is done, and it may end up with doing a cleaning and washing more than 20 or 30 times in a day. Okay, and hoarding will be there. Hoarding is collecting the things that may be at times useful things, that may be at times non-useful things, and that may be at times it is his own things or others things. So they'll be having a anxiety of losing the things, anxiety of not properly arranged things are not properly arranged, so he wanted to hoard it, he wanted to store it for no use, he will be not using it but he just want to hoard it. And asking for the reassurance, if somebody tells something, he'll ask like whether you said yes or no. So again he assures it, again he go and questions it. So again and again he'll be reassuring whether he said yes or whether he said no, whether he says he will come or whether he said he will not come. So he'll be reassuring the things. And the last one is repeating the words in their head. It may be sometimes numbers, it may be some words, it may be some like some thoughts, some I can say like some vulgar words, some few things related to sex. Okay, there are many few things which he doesn't want to express, but still that will be coming again and again in his mind, again and again he'll be repeating the words. Okay, these are the symptoms of the OCD. Then causes, the causes like anxiety. So most of the time the increased anxiety level will leads to OCD. And stress, so lots of stress or lots of tension, lots of lifestyle issues will leads to OCD. Biochemical imbalance, so when because of a imbalance of biochemicals the person will get anxiety, and that will end up with the OCD. And poor lifestyle and lack of proper planning, so there is no proper timetable, there is no proper schedule for a person to manage. So if it is not managed properly, that leads to anxiety again, that leads to stress again, and that ends up with the OCD. And even lack of proper planning, maybe he is not read for an exam for so many months, and at the end of the just there is 1 week or a 1 day for an exam, and previous day he becomes so much tense, so much tension, Okay, so improper planning also leads to anxiety, and anxiety ends up with the OCD. So these are the causes of OCD. Now, the last thing we are going to discuss about OCD is the treatment. So under the treatment, first one is medicines. Medicines are very much important because it also happens because of biochemical imbalance, and it can be balanced only with the medicine. So medicines are very much important, and being relaxed, following some relaxation techniques, following some breathing techniques will also helpful to overcome anxiety, overcome OCD. Yoga and meditation also helps to have a positive thoughts, have a positive energy, which will control the negative thoughts among a person. And thought watching is one of the most important type of a treatment, where before the therapist used to say thought stopping will help OCD, but thought stopping is very difficult for a person who is having OCD already, or even for a normal person, because some thoughts are coming spontaneously, and we can't stop it. So it will be coming. So when we can't stop it, we should not react to it. So if we react only, we will get into anxiety. So when the negative thought comes, we just have to watch. Don't go to analyze it. Don't go to find out what is going to happen after this. So just have to watch, and we should understand it is a negative thought, and if we try, we can overcome it. So that confidence is very much important. Just watching the thought, because we can't stop it, and we just have to watch, not to analyze it. When we are not going to analyze it, we will not get into anxiety. And diversion of attention. So not only concentrating on the negative thoughts, not only concentrating on the problems, on the stress, instead of that, concentrating on the productive activities, some hobbies, some good things, some positive thoughts. So that diversion of attention will helpful to overcome the anxiety. Even at the end, supportive therapy, so where I have explained already during the depression session. So that is developing some good hobbies, or what I can say, giving more importance to productive hobbies like dance therapy, music therapy, pet therapy, bibliotherapy, miliotherapy. So there are many types of supportive therapy which will be helpful for a person to overcome anxiety and many of the psychiatric issues. So by this, I'm going to end the OCD session. Hopefully these sessions are useful for the students and for most of us who have no idea about the psychological disorder. So if you find it useful, please subscribe to our channel as soon as possible. Thank you so much.